Thank you, Chairwoman. It has taken OSHA far too long to move past the voluntary guide, fact sheets, and significant fines. Instead, take strong action to protect our most vulnerable workers. While the initial ETS was a good first step, its scope was too narrowly limited to health care related settings. That is why I am relieved the administration is now taking additional steps to protect more frontline and essential workers with a broader ETS. However, OSHA must still learn from its slow and inadequate action during the COVID crisis, not only as it works to craft this new ETS, but also as the agency looks to enact other related workplace safety rules in the future. Whether it is another public health pandemic or a climate change disaster, these safety issues will always be here at the forefront in the future. Professor Shapiro, what should OSHA be doing now to be better prepared for the next pandemic? And what should Congress be doing to assist OSHA in their preventive work for the future?
In the Obama administration, OSHA was working on an infectious disease standard, which would have been a standard that could be used to head off every nature of pandemic because we don't know what the next pandemic will be. Um, and once OSHA gets this done, because right now, I think as you're suggesting, there is an emergency and we need to do this, we should start thinking about how we create a universal standard so we can act more expeditiously, more quickly, and more protectively the next time around.
Thank you. Some 40% of all workers are covered under OSHA state plans instead of federal OSHA. Some states have had these local plans, such as South Carolina, Utah, Arizona, have indicated their opposition to the forthcoming OSHA standard. There are also the same states that haven't complied to any part of OSHA's first ETS for healthcare workers or adopted an equivalent standard. Professor Shapiro, if such states refuse to implement an OSHA ETS, what is OSHA's recourse to ensure the federal standard or at least equivalent standard is enforced in those states? And what process does OSHA need to follow?
OSHA does have the authority to take over a state program if it is failing to protect workers. It's done that once before regarding North Carolina and the protection of poultry workers. That's kind of a radical remedy, but it might be necessary here. Before we get there, however, those states will be subject to lawsuits by uncovered workers that seek to a court order we call mandamus, to require those states to obey the law, which is they have to meet the minimum standards set out by OSHA. That is a mandatory duty. It's subject to mandamus, and private lawsuits by covered employees will enforce this.
Thank you. Madam Chair, I yield back.